happy almost spring. I see the trees are budding and it's just about allergy season, so what an appropriate time to talk about allergies and asthma. So before we get started, I just want to ask, how many of you guys suffer from allergies? Okay, it's probably why you guys are here. Okay, most everyone suffers from some allergies at some point in their life. How many people suffer from asthma? Anybody in particular? Okay. All right, so what I want to first do is, these are just general definitions of allergies and asthma. A lot of times I don't think people quite understand what an allergy is and why they have allergy type symptoms. So I just want to give a brief explanation. An allergy is an immune response. So it's your immune system that is, your white blood cells are attacking a substance of some sort. So it could be anything. It could be environmental, extrinsic related, or it could be intrinsic. It could be an allergy to something you're eating. Sometimes I've heard of people that react to their own progesterone. They have an imbalance. So an allergy, or people who suffer from a lot of allergies, are basically, there's just an imbalance in their immune system. Their immune system is going crazy. And what we want to do here at the clinic, and what I do as a naturopathic physician, is try to figure out, well, why? What's going on? So common symptoms of allergies are runny nose, itching, eyes, skin, dermatitis, eczema, things like that. Food allergies or bowel problems, hay fever, asthma. Again, asthma is basically a symptom of allergies. It's inflammation within the lungs. Okay, it could be, there could also be a lot of mucus secretion in the lungs as well, but not all the time. But asthma is just basically another symptom of an allergy. Okay, so when you have, think about it, when your body reacts to something, you have a antigen, which is considered the protein or whatever your body's reacting to, the cat dander or whatever it is. And then your body makes an antigen, which attacks it. And then you have this antigen-antibody complex. And that will just basically run around in your bloodstream throughout and try to get out of your body. So it tries to escape through what we call the excretory organs, right? So the biggest excretory organ is, who knows what the biggest excretory organ is? Your skin, right? So you'll have skin problems, you might have lung issues, asthma, your mucous membranes, your eyes, nose, sinuses, could have some bowel issues, urinary symptoms sometimes with allergies. So basically that's why you have those type of symptoms. It's just that antigen-antibody complex trying to be released from the body. And sometimes you get joint swelling because it kind of aggregates into the joint space. So you might get arthritis as well. So basically those are definitions of allergies and asthma. I'm not going to talk much about how to diagnose it and all that stuff because you guys all know you have allergies. So before we start to talk about treatment and natural ways of treating these things, I just want to remind you guys that I am a naturopathic physician, and I just kind of want to give you guys a reminder of the principles that I follow when I see a patient. A patient with allergies, any patient, this is what we follow. The healing power of nature, identify and treat the cause, first do no harm, doctor as teacher. Again, when you know about allergies and understand them, it helps you kind of eventually be compliant to changes and to get well. Treat the whole person, okay? Whole body, mentally, emotionally, socially, environmentally as well. You always got to look at all these aspects when you're treating someone with allergies and asthma and anything else really. And prevention, of course. Okay, those are the 6 principles. And the goals of naturopathic treatment, for when I see a patient with allergies, these are the 5 main goals. You want to nourish the body. You want to make sure digestion, absorption of nutrients is correct. Removing the obstacles to cure, which means if there's something in your life causing it, it doesn't matter how many vitamins you take, you're probably not going to get over it. So let's see if there's something causing it. We do that. Optimize elimination. Make sure those excretory organs are working well. And stimulating the body's healing force. So nutrition, homeopathy, herbs, chiropractic medicine can help with that. Mind-body medicines, there are a lot of different things. And step aside and let the body heal itself. So the body heals itself, you give the stuff it needs, I give direction, basically, and education. So that's kind of the goals of naturopathic treatment, just to remind you. So what I want to first start saying, and kind of what I'm going to do with this talk, is bring you on a walk through my mind and my thinking, which can be kind of scary maybe, but when I see a patient with allergies and asthma, kind of what goes through my mind and the course of action I take when I see a patient, okay? Now remember, everyone's an individual. I don't do exactly the same thing with every patient, but I just kind of wanted to get you to have an idea and maybe you can start seeing some things that you can start changing in your life to help your allergies. So I want to talk about allergies. Has anyone heard the idea how inflammation starts in the gut? Has anyone heard that? There's the gut-brain connection, the immune connection with the gut, the GI tract. So what my point is, I want to talk to you about first, allergies is inflammation, right? We talked about that. Inflammation usually begins in the GI tract, in the gut. So when I see a patient, I always treat the gut. So my point is gut health is very important, okay? Usually people with allergies have constipation. So I usually see that, sometimes diarrhea, but I'd say 80% of the time there's some level of constipation going on with the patient. So I just want to remind you guys what the GI tract is first, okay? It's a long tube. Here it is. It's very complicated. I can't remember how many tennis courts does it. Dr. Henshaw, do you remember how many? Like 3 tennis courts, your intestines will basically the length of 3 tennis courts. Anyway, the gut is, it's actually considered outside the body. Most people don't think of it that way, okay? It's a long tube from your mouth down to your anus, and it's not, when you eat, it's not going in your body. It has to go through absorption before anything's in your body. So your GI tract, keeping it healthy is so important. Everything from the mucus lining your esophagus to the acid in your stomach, most people don't realize this, you gotta have stomach acid. It has to be at a pH of about 1 to 1.5, which is very acidic. It kills off bad bacteria. Think about it, you're getting bad bacteria in your GI tract all the time. Kills it. It helps break down proteins for amino acids to help your immune system and everything. So the GI tract is very important. So there's different layers of the GI tract. The one I want to talk about most is the innermost layer, the mucosa. It secretes mucus, enzymes, hormones. And the main thing you have to realize is that the gut-associated lymphatic tissue, known as the GALT, that's your immune tissue. That's where a lot of your white blood cells are made. And think about it. You want your immune system to be healthy, and all your nutrients come from your food, and you want direct access to nutrients for an immune response to things, right? So a lot of your white blood cells are made in that GI tract. So that's a good fact to remember and to understand why GI health is important for allergies, okay? And it's that barrier. It keeps bad bacteria from entering. That mucosa has a lot of the good bacteria. How many people know they have bacteria in their GI tract? Yeah, so it's news to some people, but those bacteria help your immune system. They help make nutrients. They do a lot of different things, so that's important. If your bacteria are not there, the good ones, you're going to have allergies. You're going to have immune problems, okay? You're going to have inflammation. Okay, and then there's other layers to the GI tract. I'm not going to talk about that. You got the muscle layer that stimulates it to release bowel. So keeping that, that mucus layer healthy and all that healthy is important because it's that barrier. It's that filter. It keeps bad things from entering your bloodstream. Okay, it keeps proteins not broken down from entering your bloodstream. So you don't want that mucosa to be damaged. If it does become damaged, you might have heard a doctor say you have leaky gut, right? Okay, that's damage to that mucosa of the GI tract. And I'm going to explain that. I talked about the healthy bacteria is important. This is just a little tidbit. Most people that are born C-section or that their mother had IV antibiotics at birth tend to have more allergy problems. And that's due to the fact that when you're born vaginally, that's when you get your exposure to all the bacteria that you need, because babies are sterile. And you don't want to be sterile. You can't live in a sterile environment. So when you're born vaginally, that's when you get your first round of all those good bacteria. So sterile gloves touching you, C-section, not the health, of course you need to be born C-section at times, but these babies need to be on probiotics and stuff early on. Okay. And there's information, I talk more in depth about that. So this is just a little diagram that talks about how leaky gut happens, okay? It doesn't happen overnight, it happens over years, okay? So on your left, poor diet, alcohol, chemicals, food additives, food preservatives that we all grew up on. I ate a ton of them when I was a kid. Stress, infection, all of those cause damage to the good bacteria, and at the same time, you're getting lack of nutrients for cell repair. And this happens over years. So you're damaging it, and you're not having everything you need to repair them. So then over time, invasion of bad bacteria happen. Then you lose the loss of cell integrity. So those cells that are held together really tight by tight junctions in your GI tract, they're inflamed, they're eroded, they're irritated, and they kind of swell because inflammation is swelling. They kind of detach. And then things can leak in between the cells, hence the term leaky gut, okay? So whole proteins that aren't digested, because people think, well, why would I react to broccoli? Well, it's that broccoli protein's not being broken down, and you have leaky gut, it leaks through, okay? So working on digestion and healing the GI tract will help with food intolerances that can cause allergy symptoms, okay? Compromised immune system, food allergies, impaired digestion and elimination, you start having disease with leaky gut, okay? So you always address the gut with allergies and any type of inflammatory disorder, and I'm going to show you this. So I told you, what is the connection? Allergies and asthma caused by chronic inflammation. You want to heal the gut. So, treating the gut helps all of these. So all of these type of disorders, and if you know anything with itis on the end, is inflammation, right? Mm-hmm. So sometimes leaky gut just manifests differently in different people, depending on other factors in their life. But allergies usually is, people come to see me with inflammatory bowel disease, but they have allergies. Or they come to see me with thyroiditis, and they have allergies too. It's usually, they think that's not what they come to see me for, but that's always there when they have inflammatory disorders as well, okay? And when I say allergies, I mean upper respiratory allergy type symptoms, okay? So that's just a little background of the gut and why I treat the gut, because everyone always asks that, and so I hope you guys kind of have a better understanding of that now. So where do I start? So here I'm going to talk about if you came to see me with allergies, this is kind of, after I do a history and physical and all that, this is kind of what I think about when I think about treating someone naturally for allergies. So the first thing I think about is consider specific labs. Heal the gut, of course, I just talked about that, and I'll talk about that in detail a little bit in a minute. Diet changes and proper nutrition, we'll talk about that. Avoiding toxicity. And then I always think consider liver and adrenal support, because stress, the adrenal glands, usually that's related to allergies. So depending on the person, I consider liver and adrenal support. And then we're going to talk about specific supplements, things that you can go and start taking to help with allergies, okay? So talk about labs. Food allergy testing. That is one of the biggest lab tests that the first thing I would do with someone with systemic allergies, especially in kids. Kids with allergies do very well with just avoiding their foods and healing the gut. Digestive stool analysis can be helpful, and that just looks at your pancreatic enzymes. It looks at inflammatory markers. It tells me, do you have good bacteria? Do you have any bad bacteria? Do you have any yeast growing in your GI tract that could be causing leaky gut? So that's a lab sometimes I consider in certain allergy patients. Adrenal stress index, that's just looking at your adrenal glands. How are they functioning? Your adrenal glands are the ones, your stress glands that secrete cortisol. So stress, people say, well, I get allergies when I'm under more stress. Well, the adrenal's not working properly can cause more allergy symptoms. So looking at that in certain people is beneficial. Then, of course, complete blood count. If your eosinophils are high, that's a certain white blood cell can be indicative of allergies. Looking at your liver panel, metabolic panel is important. Thyroid testing can be important too. So people with low thyroid can have more allergy symptoms. So sometimes that's important to look at. Specific nutrient testing, the main ones that I like to look at for allergies is essential fatty acids, because if those aren't properly balanced, you'll have more inflammation in the body. So we can kind of see what's going on with that. Vitamin D, vitamin A, vitamin C, E, B5, B6, zinc, and magnesium. So I'm not going to talk in detail why I would look at these first, but those are the first nutrients that I would consider in someone who has allergies, okay? So after I think about allergies, I always start healing the gut right away. If we do a stool analysis, I wait to get that back for certain things, but healing the gut is important, and that's the next first thing I do with every patient, usually. So what does healing the gut mean? That's what everyone asks. Well, doctor said I need to heal my gut, but what do I do? What things do I need to focus on? So this is what I learned in school, and this is what I think in my mind when I see a patient. So healing the gut, you think of the 4 R's, okay? You remove, replace, reinoculate, and repair. And we're going to talk about that. So repair, you see, is the last one. You want to heal your gut, but you got to do those other 3 first, okay? So remove, what does that mean? Removing bad bacteria, yeast, fungal overgrowth. A lot of people have chronic yeast in their GI tracts that can cause leaky gut and food and allergies and all kind of problems. Environmental allergens, I always want to tell people remove. Candles. I mean, if you're spraying Lysol all the time in your house, well, probably want to not do that. Cleaning sprays, hairspray, paint fumes, mold. I mean, all of those you have to address as well, because that could be the obstacle to cure that I talked about, okay? And I usually help people think of alternatives, because I can't just tell someone, you know, don't do something they've been doing for 50 years. So my point here is that, you know, patients always say, well, I changed my dryer lint, I changed this, I stopped burning candles and it didn't help. What point I want to make is that with allergies, it's not always just one cause, especially the low grade, you know, when you have anaphylactic reaction, a lot of times it's one cause. But these low grade allergies, it's the load that's important. If you have a threshold, if you get over that threshold, you're going to have allergy symptoms. So we want to decrease your load. And these environmental things are things that you can start controlling, especially in your home for the most part. You can control the allergens in your food. So that's why we always start with food allergies and food additives and stuff like that, because that sometimes can get your load down enough where your allergy symptoms start regressing. Okay, so it's about the load, not the individual allergen most of the time. And then remove the food allergies. That would be part of healing the gut too, okay, the remove part. And sometimes if you don't have access to these tests, I mean, you'll read books about the most common allergenic foods. And so these are the ones that you'll probably read about: the nightshades, wheat, gluten, dairy, soy, eggs. But I'll tell you, it is so individualized. Like for myself, I'll give you a little story about myself. I've never had allergies a day in my life until I moved to Kansas. And I've moved a lot of places. Raleigh, Phoenix, I've lived a lot of places. Last January, I started having more problems with that constant, I'm like, oh, no, I don't have time for that. So I did the food allergy panel, and I ended up checking my thyroid too, and there was some stuff off with the thyroid, but green peppers. And I ate some yesterday, because I love green peppers, and I tell you what, it causes a lot of allergy symptoms in me for some reason, so I'm not eating green peppers anymore. But green peppers are very healthy, but they cause problems in me anyway. But when you want to avoid an allergenic food, some people will say, well, I avoided it for 2 weeks and I didn't see a difference. You've really got to commit 6 weeks to 3 months, especially with your food allergies, to really see a difference, because you got to get the load out of you, okay? So you can try eliminating these. Elimination diet's the best thing to do for food allergies if you don't have access to testing. But I like the food testing because I don't want people avoiding something that they're not really allergic to. So, okay, step 2, and that's 4 R's, replace. You want to replace any nutrient deficiency you might have, okay? It's common deficiencies I see with allergies, just for your information: zinc, vitamin C, omega-3 fatty acids, D3, and B12. I see a lot in allergies. So we can test those. Remember, everyone's an individual, but those are the most common ones that you want to think about. Replace digestive enzymes if needed, okay? Because supplemental things, or you can supplement digestive enzymes or bitters, like bitter greens before your meals. That's why a lot of times you eat greens before a meal to stimulate digestive juices. There are bitter drops you can do, or you can just take enzymes. So I always like to use, bitter greens or something like that first, but sometimes people are just so damaged they need straight enzymes. So it just really depends. Hydrochloric acid sometimes is helpful. Okay, especially the elderly, and especially with reflux in the elderly. A lot of times it's not enough hydrochloric acid. So that helps break down protein and helps with digestion, okay, supplementing with that in certain patients. So that's the replace. So also part of replace is replace your foods that you choose to eat. Reducing pro-inflammatory in foods are important. Meat, sugar, alcohol, caffeine, refined carbohydrates, trans fats, which are your margarine, your fake fat, right? Causes a lot of inflammation in people, messes up your GI tract. So that's important. You want to reduce those. Now, I'm not saying eliminate them completely, because you need to have some inflammatory items. You need to have inflammation in your body, but you want to reduce it. Really take a look at your diet and see what percentage are you eating. You want to increase the anti-inflammatory foods. I always say focus on that, because if you focus on increasing that, naturally you're going to decrease the bad stuff. So eat more fish oil, fish. Grass-fed beef is way less inflammatory than grain-fed beef. It's because of the fat content, it's different. Whole grains are better. Ginger, turmeric, spices. I always tell patients, start using spices. Look up some recipes. There are a lot of benefits, anti-cancer benefits, detox benefits of turmeric, garlic, cilantro. Green tea has been shown to be very beneficial for inflammatory disorders, particularly allergies and interstitial cystitis and stuff like that. So I always say 85 to 90% kind of Paleolithic style, because people always ask, what kind of diet? They want a name for it. So I would say Paleolithic is probably the best, or some kind of mix between Paleolithic and Mediterranean diet. But there are just so many books out there with different names for diets. But I think that's the best for an allergy type diet, okay? So you can look up that, find books on that. Basically, Paleolithic is dairy-free, grain-free, okay? Lots of good, lots of good fat, nuts and seeds, lots of vegetables, lots of fruit, lean meats and fish and stuff like that, okay? All right. Step 3 in healing the gut, re-inoculate. So that just means give the good bacteria back. So probiotics, sauerkraut, yogurt, but be careful with yogurt. You might need to take more probiotics, because yogurt doesn't have as many good bacteria as you think, especially commercial yogurt. Anything with dyes in it. Yoplait yogurt is probably the worst. Any light yogurts, don't eat. You don't want any of that. Just real plain yogurt. So kefir, sauerkraut, fermented foods will help re-inoculate. Kombucha, it's another thing people can drink. So the last thing for healing the gut is repair. Okay, especially if you have IBS or inflammatory bowel disease or something like that, you want to actually work on repairing it. So replacing the nutrients and all that stuff indirectly you're repairing. But these are some things that if you're having GI problems or pain or diarrhea or something, you can do they call it herbal demulcents. And all that means is that those are herbs, and usually they're chewable. Like our DGL licorice is chewable upstairs, and it's chewable because you want it to basically coat your esophagus all the way down. These are herbs that really coat your tissue and are very soothing and healing to the tissue. So it helps drop inflammation. So things like licorice, normally DGL form, which is deglycerideized licorice, is what's used for GI problems. Slippery elm, marshmallow, not white marshmallows, it's actually an herb. And plantain are usually the herbs that you use for demulcents and stuff. These are really good for reflux. If you have allergies and you have reflux, because probably doctors will say your cough is due to reflux, and that's another lecture to explain that. But these are really helpful if you're having that heartburn, reflux problem, and allergies. So repairing the gut, also L-glutamine is an amino acid, which is the main amino acid your GI cells use for repair. So that's one of the important things for allergies. And N-acetylcysteine helps with repair of the GI tract. And in a minute, I have this listed, but N-acetylcysteine is the precursor to glutathione. Anyone heard of glutathione before? You know, glutathione, they use them in kids for breathing treatments for asthma and RSV and things like that. It's a major antioxidant in the body, but it also thins mucus. NAC I use in patients who have a lot of mucus and allergies. So they got sinus junk up in here, lung congestion, asthma, things like that. So it really helps thin so you can expel it, basically. And vitamin A, biotin, and zinc are the 3 nutrients for GI repair. And remember I said vitamin A and zinc were major deficiencies in people with allergies. So you're going to start seeing some trends here. So when it comes to actual repair, this is what you want to focus on. Okay, so it listed in I just put this in here for your information. These are just some supplements we carry that are specifically for repair, just so you know. Mucosagen has a lot of those demulcents I talked about, and L-glutamine and things for actually step 4. So if you want to write step 4 for R4 or whatever, repair, mucosagen's good for. GGL is great for repair in people that have reflux, and I wrote that down, or chronic cough. And L-glutamine power, pure vitamin A, and zinc are supplements for repair. All right, so just to recap, just to remind you what we just talked about for healing the gut: remove, replace, reinoculate, repair, the 4 R's. So you always address that with allergies, basically any inflammatory disorder, but especially allergies, okay? All right, so the next step with healing the gut, I talk about diet changes and proper nutrition, and then avoiding toxicity that you can control. And I'm going to repeat myself a little bit because diet and lifestyle changes is important for healing the gut too, and I just said a lot of this. So I'm just going to repeat it so you remember. Eliminate all food allergies. Food additives, big time, okay? And I put especially the benzoates. So when you look on your label of anything you're eating or putting on your food, or especially what you're drinking, benzoates are in those energy drinks, they're in a lot of health drinks. Read your labels, not good. Sulfur dioxide, sulfites, one of the common additives people have allergies to, so wine, dried fruit, shrimp, the 3 major things. Also, it's in other stuff. You know, I always tell people, just read the label. It's in store brand Wheat Thins, it's not in Wheat Thins. So you really have to just know your food labels. I know food labels too much, actually. And yellow number 5, that's probably the biggest dye issue in people with allergies. All of them are pretty bad, but that's one of the biggest. And think about it, yellow number 5 is in everything that kids eat. Captain Crunch, it's in mac and cheese, Kraft mac and cheese, it's in cake mixes, cupcake mixes, pickles. So avoid that. Ibuprofen, aspirin, they can cause allergies in people. So if you live on ibuprofen and aspirin, remember it can cause inflammatory allergies. And I put that it increases leukotriene, so if you know what that is, those cause inflammation, basically. Cold water fish and decrease animal protein. I already talked about that, okay? Bioflavonoids. Who's heard of bioflavonoids before? Fantastic for allergies. Quercetin is great. Ginkgo is a bioflavonoid. There's a lot of other bioflavonoids out there. But I always say bioflavonoids are the color that are in the fruits and vegetables, so try to get every color every day. Make that kind of a goal. Kids like to do that, so if you have kids that have allergies, you know, make a little chart or something and they can try to get every color every day, and that's helpful. Eliminate refined sugar and grains, drink green tea, decrease animal fats, okay? Corn, peanut, sunflower, and safflower oils you want to decrease. Those are the oils that's in processed food, so you want to use more anti-inflammatory type oils, okay? All right, so I already talked about this. Aerosol sprays, candles, wash your pillowcases regularly, things like that's really important. Natural cleaners, that's another one. If you're cleaning the house all the time, try to use more natural ones, and you don't have to buy the fancy stuff at the store. Some of those really aren't natural. You just make your own out of vinegar and water, alcohol. You can get essential oils and put lemon in it or something to make it smell better. Chiropractic adjustments are good for asthma. All right, specific supplementation. Okay, that's the next step that I do with patients with allergies. And we talked a lot about this already. So depending on the patient, I don't have everyone take all of these, but it always depends on what else is going on in their system. That's kind of how I pick and choose. And also lab results, if we do a lot of lab results. So, but these are the major ones that are extremely helpful for patients with allergies. Omega-3 oils, if you're not on fish oil, you need to be. Most every person is deficient in omega-3s, even if you're eating a lot of salmon, okay? And always get Alaskan salmon. Atlantic salmon is probably the most toxic food we can eat, so Alaskan salmon. Vitamin C is extremely important, okay? It helps with healing. It also helps with histamine, helps stop histamine release from the cell, which is histamine actually is what causes the allergies, right? Antihistamines is what you take. So vitamin C can act in a different route like an antihistamine. Same thing as quercetin. A lot of times quercetin is with vitamin C, and quercetin is that it's a bioflavonoid, which I already talked about, but it's in a lot of onions, garlic, but quercetin has an affinity for the upper respiratory tract, okay? So the sinuses and stuff, like ginkgo, for instance, has more an affinity for the brain, but quercetin is what I would use with general allergies, cough, chronic cough, sneezing, itchy eyes, things like that. Vitamin A and beta-carotene, especially beta-carotene. High amounts of beta-carotene is really important for allergies and for the lungs if you have asthma. If someone has asthma, I usually put them on pure vitamin A. Beta-carotene, by the way, is a precursor to vitamin A, in case you didn't know that. That's why they're hooked together. Vitamin A is 2 beta-carotenes hooked together, so they're related. But vitamin A can be toxic in the body, so you got to be cautious with vitamin A. But a lot of beta-carotene is important. So anything orange, carrots, sweet potatoes, things like that, beta-carotene is in. Selenium, great antioxidants for the lungs, especially patients with asthma. Selenium is important. It's also important for people with thyroid problems. B12 injections can be helpful for patients with allergies. Sometimes iodine I give patients. That can help, especially if they have that clearing of the throat all the time, because it can help hypothyroidism. But you got to be careful. Definitely have a doctor help you dose iodine, because you don't want to do too much either. Magnesium, that's really good especially for asthma. Oral magnesium, and I have a lot of patients we have to do magnesium pushes via IV. They have chronic asthma problems and migraine headaches and stuff like that, but magnesium via injection, IV, or oral can be done. So even patients with chronic pain, I'll do magnesium injections that have allergies, and helps their allergies as well. So, all right. So there are so many herbs and herb combinations for inflammation, and when it comes to herbs, it's really all about knowing the patient and the individual when it comes to picking it, which ones are best, because you can't take all of them. But these are the ones that I find to be the best for asthma and allergies. So you probably have heard of these. Curcumin, turmeric, right? It's in a lot of Indian food. If it's dosed properly, it can be very good for allergies and asthma. Boswellia, which is frankincense, is good. And a lot of these are in combination. If you like the D-hist I have over there, I kind of wrote what's in it, but that's a combination one that we have here that addresses allergies. Nettles is an herb. That's great for especially people that sneeze and have itchy eyes and just sinus congestion and everything. Ginkgo is important. NAC, again, thins mucus. So if you have allergies with you get a lot of sinus congestion or lung congestion, NAC is definitely something you want to be on. It's that precursor to glutathione. And underneath it, I have liposomal glutathione. It can be a good supplement to take however you want to. It can cause some detox in you and can maybe, it's not a bad thing, but you might get a headache and stuff when you first start taking that. But I just want to make sure liposomal glutathione, you can't take glutathione orally. unless it's liposomal. So don't waste your money on capsules because your digestive tract just breaks it down. And so DHIS is one that we have here that contains, it's just a combination one. So it's all in one bottle that can be really good for just your upper respiratory type allergies. And I just want to talk a little bit about, because I see a ton of asthma and allergy patients, people with allergy and asthma. And I want to talk about some other therapies that we do here that can be extremely helpful. Intravenous therapies, that's IV therapies. And we do, and this one I've been seeing tons of amazing results with lately, the ISRR injection. Anybody heard of that? I'll explain what that is. So intravenous, so IVs, we do a lot of Myers vitamin C IVs here. It's kind of what our clinic is known for. We do it for a whole lot of disorders, but it can help with allergies and asthma. Sometimes I add selenium and extra magnesium in people that have allergies. That can be very helpful. Ultraviolet blood irradiation, that is basically where we treat your blood with UV light. Okay, so UV light can be extremely helpful for inflammatory disorders. And UV light's an antimicrobial. So this is especially good for patients that have chronic infections with allergies and asthma. They get sinus infections all the time, they have pneumonia, they're in and out of the hospital, walking pneumonia, strep pneumonia, all of those. I would do some UVI treatments on them. Very beneficial for it. ISRR in asthma, this is a quick little injection that I've seen a ton of amazing results with. It's the Infraspinatus respiratory reflex injection. That's what ISRR stands for. Anybody know what the infraspinatus muscle is? No? Okay, so it's one of your rotator cuff muscles, basically. It's on your back. It's on your shoulder blade. So on those two muscles on your shoulder blade, there's a reflex point, and it's a trigger point, but it's also one of the major lung points in Chinese medicine, so remember that. And basically what we do is we inject some lidocaine and a small dose steroid. However, it's a teeny bit of a steroid. But in some patients, and I actually did type it on here, I've just used lidocaine and B12, and it's worked just as well. So I think it's more of the actual injection rather than the ingredients of what's in the shot. So it's the reflex of doing it. And these people who have asthma, this is great for asthma, people who have asthma, if you feel this point, and you can feel it on yourself or your loved one, when you do it, feel for the spine of their scapula, and you want to do 2 thumb links down. So you do 1, 2, and it's usually right there. And if it's tender and they have asthma, they will definitely benefit from the injection. And it's always 2 thumb links down that's their thumb size. So if it's your husband, he's got a bigger thumb, you want to do a little bit down. You got to remember that. And they will feel it when you press on it. And so what we do is we inject basically 4 cc's. It's pretty painless because there's lidocaine in it too. It's a very tiny, tiny, tiny needle. And I think the ingredients and the stimulation of the point cause a response. I don't know. I think it's more the stimulation, but usually they get immediate relief, and it can last up to 1 month. People with chronic asthma, what I've seen is that it lasts about a week. And they come in once a week for about a month, and then it will start lasting longer. So, and I've done a lot on Dr. Ron's patients that he's been doing them on for years, and I've heard amazing stories, and so it's been really good. And some patients get immediate relief for actually years. It's actually kind of interesting, even interesting for me. So my conclusion that I want to make is allergies and asthma are inflammatory diseases, and all of them start in the gut, okay, over years, not overnight usually. And healing the gut's important, working on digestion and nutrients is very important. So you don't just want to use natural substances to treat the symptom. That's what I'm trying to say here. So there's a lot of great herbs and stuff that treat the symptoms too, but you want to address everything if you want to get completely healthy and through your allergies. And usually it takes some time, 3 or 4 months, but in the grand scheme of things, that's not that long. And they can be improved or cured by healing the digestive tract and looking at everything else. So I can't promise that, but it is definitely possible, especially asthma. And I just want to remind you again that, you know, what I just went through with you in the walk of my mind when I see an allergy patient is these are the things that I'm trying to do. Nourish the body, work on digestion and absorption, removing the obstacles to cure. So it can be physical, it can be mental, stress. I mean, sometimes decreasing that load that I talked about, getting out of a bad relationship or a bad job, or, you know, things like that can help allergy symptoms because you're dropping the inflammatory load that stress was causing. So you have to address all that stuff too. Emotional and spiritual blocks, and those are important as well, and don't forget that. Optimize elimination. So if you have a lot of allergies and you're coating your body in baby oil or any type of lotion with petroleum in it or mineral oil, well, you're blocking your major excretory organ from releasing stuff. So you want to avoid that kind of stuff, putting that on your skin. You want to do things that aren't going to put a coating on your skin. You want that to breathe. You know, even things like dry skin brushing. And you can get a brush and you stimulate your lymph system, and that can help with detoxification and allergies and stuff like that you can do. You know, and you get a brush for $2. It'll last you a year, so that's cheap and easy. Stimulate the body's healing force, nutrition, of course. Homeopathy. I don't do much homeopathy, but I'm beginning to do some in some patients again. Spinal manipulation is important, the structural, making sure the nerves are working properly from the spinal cord. Herbs, mind-body medicine, all that stuff is extremely important. And then don't forget the healing power of nature. Okay, nature is amazing. Your body wants to work properly. You're no different than the next person. You just got to figure out what is going on, what are the blocks. Identify and treat the cause. It's not always evident. A lot of times you got to do some digging. First, do no harm. Doctor is teacher. It's important. Know what's going on in your body. Ask your doctor to explain things. Look it up. I mean, I think, you know, educating yourself is good, although we can educate ourselves too much at times. Treat the whole person, full body. So that's why when you come in with allergies and asthma, I'm going to ask about everything. I want to know everything going on because that helps me guide treatment and pick out the right things, because sometimes that's how you figure out the cause. But if you come in and I just say, here, take this, this, and this for your symptoms, I'm still not practicing my medicine. So that would be doing you a disservice. And then prevention, of course. So I always say start with your kids. You know, if they're born C-section, start them on probiotics early on. There's a lot of things. I work with new moms on preventing allergies in kids. So that's important. And we can't prevent everything. We don't have control over everything, but we can at least do what we can control. So that's important.